Testing. 1, 2, 3. La 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 la. Okay, I'm sorry,
Hello.
guys. I always
Hello.
wish that I was a good singer, but I'm not.
Me too. I'm tone deaf. But it's the Miriam and Hass soulmate episode.
Soulmate reunion. Woo.
Soulmates
forever. That's our little theme.
Soulmates.
So adorable. Well, welcome back, everybody, to Bundle of Hers. So excited to be back in the virtual studio recording with said soulmate. Ha, say hi.
Hello. Where's Timmy?
Oh, he is Timmy the cat, the official mascot of Bundle of Hers, by the way. He is hanging out in my room, just doing his thing, chilling with us, motivating us to get our episodes recorded in a timely fashion. Anyway, so this episode is really just about the power of storytelling in medicine. And I felt like this was a topic that I really wanted to just kind of expand upon on Bundles, because one, Bundles is a really unique platform that I think centers on the power of storytelling. But to my knowledge, I don't think we've ever had an episode like specifically dedicated to exploring how storytelling specifically can be used in activist spaces. And it's something that I've been thinking a lot about. And so I wanted to do this episode. And I'm so happy that I'm doing it with Ha, because fun fact, I feel like me and Ha's relationship, we started out as like big sib, little sib. We have this mentorship program at the U. And she was my big sib because she was a year ahead of me. And that's kind of what started our, mentorship relationship. But I feel like our friendship was really rooted in like that power of storytelling and connecting to identity through storytelling. And I feel like Has probably one of my friends where I can see that the most in how she approaches her activist work. And so I'm so happy to be on this episode with you, Ha.
Yeah, I'm excited to be on this episode with you just because, you're my soulmate. So I think that's what matters. But I love talking about storytelling and like the medical humanities and all of that stuff, because as people may or may not know, depending on how loyal you are and whether or not you choose to screen out my episodes or not, I used to do journalism as like extracurricular journalism throughout high school and college. So I love hearing people's stories and telling stories. But before we start like talking about stories, because, I'm a working individual, I always need to put in the disclaimer that the views expressed in this episode and what we talk about do not reflect the views of our employer or the institution to which we are associated. And this podcast is associated. It is just our own opinion.
I ditto that. Cool. All right. So let's just jump right in. So I guess I will kind of start with how I started thinking about this topic a little bit more in depth. I think about a week ago, I attended this Tetris workshop. For those who don't know, Tetris in Arabic means embroidery. And it was a workshop that kind of talked about like the history and like the cultural elements of Palestinian embroidery and how it's used as a way to kind of preserve culture and like celebrate culture and also to tell a story. And I just thought it was so, so beautifully said. And it reminded me a lot of my own culture, because Persians, Afghans, like we are huge into embroidery and weaving. And, we are known for our beautiful rugs and like just art collections that tell like beautiful stories that are passed down from generation to generation. And it really just had me thinking about how when we think about different communities, for example, indigenous communities here in the States or communities globally in the Middle East, like these communities all go through different struggles. There's really difficult things that a lot of these communities have gone through, including assimilation and ethnic cleansing, and how a lot of that is really rooted in not just an erasure of people and like bodies, but an erasure of culture and art and all the things that are beautiful that make us feel connected to our humanity. And it's just something that I, again, was thinking about quite a bit, especially as I'm ending my career as a medical student and entering into residency and wanting to rethink the ways that I approach activism and rethink the ways that I want to center my patients in that work as well. And so that's kind of what we're going to chat about today. I love to open up my episodes with really broad questions because I'm just cool like that. But it's also because I'm a little bit lazy and I don't like asking detailed, thought-provoking questions when I first start a topic. But question for you, Ha. In what ways have you, I guess, related to storytelling or used storytelling just in your own life?
I think I start like thinking a lot about storytelling first, like in just my upbringing. A lot of the ways that my family really helped like pass on like our traditions and our culture and also our history was really by telling stories of their experiences. I feel like for like how youthful I was, young I was, I think my mom and my grandparents were still fairly like honest about their experiences growing up in Vietnam, particularly for both generations, like during a time of war, because they grew up during World War II. And then my mom grew up during the Vietnam War. And those stories were really ingrained. I would also hear stories about my great grandparents and about all of the things that they did. And so it was so funny because I felt like even my family history was created into something that often felt like a legend, like a really like big tale and very like epic. And from that, it started making me like really like love like stories. And I, as a child, I also just really liked reading books. My mom, like our weekly activity is that we do the laundry and then I would go to the library and just spend like hours in the library reading or like checking out movies and then watching movies. So a lot of my like life growing up was ingrained in just like stories all around me through like different forms in media, be it oral, be it written, be it visual. And it carried into when I started doing journalism in high school. The thing that I really loved about journalism was the excitement that people felt when I was able to tell their story. Like they were like when I featured like things that they were passionate about, my fellow like classmates were super stoked. They're like, thank you for featuring the play that I was in. And that carried into college when I chose to do arts journalism, which allowed me to do a lot more feature pieces and really like getting people being excited about their art and be excited about the ways that they view the world and really being able to emphasize that and elevate it. That brought me so much joy. And so I think stories it was like a way of me to like really center it on people. I felt like stories were so interconnected to people and their experiences. And I felt that way both like in a very like I guess I'm thinking about books more like nonfiction sort of way. But then I also saw it a lot in like fiction too, like how people process their experiences through it. And in medical school, I was super into like the medical humanities and doing like narrative medicine is the word. Yeah, narrative medicine. And it was because I felt that it was such a powerful way for us to process really hard things and for us to really even share our viewpoint with others. And it was such a healing way for us to really get to the heart of medicine that I think gets lost in the facts. And that's like something that I just feel like whenever you ground anything in stories, it becomes real, it becomes tangible. Yeah. And it's also just because, I'm sorry, this is such a ramble, but I guess I have so many thoughts about storytelling. I think it's also just because, particularly when I do activist work, I think sometimes we can get caught up in, I don't like the word branding, but like the image, like the vision of what being an activist is. And it can sometimes lead you astray when you like really like just lean into that vision instead of really grounding it on the stories of the people. And so that's another reason why I really just love grounding things in stories, because whenever I go back to the people that I'm serving and their stories and people's experiences, I'm brought back from like this very like high like academic or like this very high like it feels like you're brought down into something that's more tangible and more real and also able to do more connection.
Yeah. Kind of similar to you. I think growing up in, this isn't specific to immigrant households, but I really feel like a lot of us, like as the children of immigrants, really learn a lot about our parents through stories. I remember I talked about this in my Afghanistan episode back a couple of seasons ago, about how I learned about my mom's side of the family and learned about my mom as a person and my like Afghan culture was not through my mom explicitly telling me throughout my upbringing, but was really more through bedtime stories. When I couldn't sleep at night, I would go into her room and I would be like, Mom, I can't sleep. And she would be like, okay, Batshim, I'm going to tell you a story and then we're going to, go to bed. And she would start singing a traditional Afghan song because that's the way that she traditionally, like Afghans would start their stories. And she would always tell me these stories from her childhood of when she has like these hilarious stories of like when she would go to school and like, all the like naughty, like little childlike things that she would do to get in trouble. One time she burned her professor's beard with a candle. That's like a whole other story. This is one of my favorite stories of all time, but I pictured, little Fauzia, it's my mom's name, little Fauzia, just like running through a school in Afghanistan and just like being this like strong, independent little girl who grew into this like really strong, independent woman. And it just made me not only like appreciate like the culture that I grew up in and how she was raised and how that informed how I was raised, but it helped me also better understand my mom. And it made me feel so much more connected to my identity and also just generally made me feel more Afghan. And I have tried to read, history books, nonfiction books, watch documentaries, stay informed about my culture, for example, and what's going on politically and all these different things. But really what makes me feel so connected to my culture is storytelling. And I think it really started with my mom's stories, but there's also other ways through which I felt like I learned a lot about things that were really important, especially in the social justice space, that were rooted in identity that were conveyed through storytelling and not necessarily through like oral storytelling, which is what my mom did when I was younger, but through like different means, like this Tetris workshop, the embroidery workshop that was so beautiful. I was really moved because not only did we learn about like the history of Tetris and how it's been used as a way to preserve Palestinian culture and celebrate Palestinian culture. But we also learned the basic skills of Tetris, and you get a real appreciation for how people connect to the resources that they have in their land and how they use it to really write a beautiful story. And I will tell you, it is very hard. Like, like me, like doing any type of embroidery was like very laughable, but it was actually such a beautiful way to connect to something that felt really meaningful. And I think through the practice of doing the embroidery, I felt like I could really understand at least some aspect of the stories that were conveyed historically through these pieces. And it's interesting because we can tell stories through so many different means. Like, so we talked about embroidery. Another thing I think about is like food is another way to tell stories, especially like in our culture. I remember after my dad passed away, my grandmother, who was like this renowned, like she could literally open up her own Persian restaurant, right? Like she is so talented. I remember after he passed away, her way of grieving was through the way that she cooked her food. And it was very specifically like not adding sugar to a specific dessert recipe, not adding a specific spice that really like flavored a dish a certain way to really convey like how she was feeling. And in a lot of ways, that's kind of how we communicate with each other and how we grieve and how we express our emotions and also how we tell our stories. And so it's just kind of a multifaceted, I guess, experience with the different ways through which we tell stories and how we connect to our cultures and our identities.
As you said, there's like so many nuanced and so many beautiful ways of telling stories. And yet I also always feel like there's like certain ways that you tell stories or certain like perspectives in which stories are told that have a bit more weight and a bit more like relevance and like a bit more acclaim than other things. And it's really interesting. And I think maybe I'm like thinking a bit about it a bit more because I'm currently listening to the audiobook Yellowface by R.F. Kuang. And for our readers who don't know, it's basically the whole plot and gist of it is about this white woman who like steals the ideas of her recently like passed away Chinese classmate, and she like publishes it under the moniker of like Juniper Song, which is her song is her middle name. And basically it's just this whole like thing about like what it means to like publish in the industry, and it's very interesting. But it made me think a lot, it's making me think a lot about how we like put weight on certain stories, you know, and the power that we give by like allowing certain stories to be more like prevalent and beloved than others.
I guess like, and you kind of alluded to this a little bit, but I'm hoping you can expand on this. How do you think like storytelling in your experience, how has it shaped your identities, but also like how you approach work in social justice, especially being a resident and wanting to be an attending physician soon?
For me, when I use storytelling, it was often really like ways for me to process things. In medical school, like I would write a lot of like poetry, and I would write a lot of like fiction, trying to process an experience. But I also sometimes feel like when we like tell people, like there's always like a lot of vent sessions in medicine where you're like talking through like a patient situation, or you're like trying to like process something. And that, I think it's like seen as like just like venting, but I think that's also a form of like collective storytelling where you're like share like your own patient experiences and try to like connect with each other in that way and finding that shared experience. I think one of the things I reflect on a lot is about how like different stories can be like interpreted in different ways. As a resident, sometimes like I'll get this like message from like one person in their care team saying like this, and then I like talk with like a different person and they say this, and then like I talk to the patient and they say this. And it's very easy to like prime yourself and to think like you know a situation just based off of like what others tell you, or even like on like the EMR, like sometimes for certain patients, it will show up with this flag, right? Like behavioral flag or things like that. And that's a way of like telling people like a person's stories. Yeah. One of the things that I'm always like finding myself checking myself and like remembering to like relearn is, especially in trying to be a very like patient-centered provider, is to like take in the different perspectives from other people, but not let it affect how I approach a situation that I have with a patient. Because oftentimes I find that like certain things that I've been like told is like completely like miscommunicated, and it's not like on the other person's, but that's how they perceived it, right? And it makes me realize how tricky that like is, like when you're trying to like advocate for patients within the clinical setting, how much like stories can be like really misconstrued, and how important it is to like center it on like the patient's story and the patient's perception. Yeah. Because I'm always like pleasant. I feel like it's more often than not that in situations where I'm made to feel like something is a bit like bigger and like more serious, I'm always like, when I like walk into the room like with an open mind and I'm like ready to have that conversation, I'm always pleasantly surprised by the fact that it's not as like big as it was made to be to me. Yes. And I think that like comes back into like then how I also think a lot about doing like activist work. I think especially I like love a lot of like medical education, and I'm like really interested in like curricular development, because I feel that's the best way that we're able to really like create impact, because you're like trickling it down in a way. But it also means like if we're designing this like curriculum for this patient, or thinking about education for patients, why is it that oftentimes it's like us like going off of studies or going off of like things and not really centering people's stories? And I feel like there's kind of like a more like work now, like about like bringing in like perspectives and like collaborations with youth or with families about really being able to like guide how we do things. And I think that's also really helpful, and that like all just goes back to really like stories.
Yeah. I think I can relate to a lot of that too, because it had me thinking about like, especially when you're talking about the patient care aspect of things, when I've been on rotations, when you're a medical student, you have the very unique, I would say pretty unique opportunity to spend more time with your patients because you have less of a patient load. And on top of learning the medicine, you're also learning how to interact with patients in the healthcare system. And so usually you'll follow anywhere from 2 to 4 patients as a medical student, which is significantly less than like residents are expected to. And so with that extra time, as you're learning the ropes, you're also sitting down and like listening to ideally listening to your patients a lot more, right? And I think it really struck me when I first entered my clinical years as a third year, being able to like sit down with some of my patients. And there were days where it was a little bit slower and I, was only following 2 patients. And so I would really just sit down and like want to hear a patient's story. And what's really funny is a lot of these patients were so eager to tell their stories too. I think patients, being in the hospital is not an ideal place to be, but patients want to feel heard and seen. And unfortunately, the hospital and this healthcare system is not a place where patients tend to always feel that way, right? And so sitting down with a patient and really just hearing their story, and it didn't have to relate to their illness or why they were in the hospital in the first place. I would hear patients talk about their marriages, their families, what they love to do, their travels, things that were really important to them, their cultures, and I think it would do a couple of things. One, it would bring a lot of perspective into this process and how I thought of my patients and how, invested I was in their care. The other thing too is, it brings like this level of humanity into medicine that's just taken away from our training. And I think, again, like the healthcare system, it's a business, right? And it's about getting people in and out of the hospital. It's really high turnover. So you don't think and pause and like think about like the people who you're actually treating. And I think that level of humanity and bringing that back into medicine as much as possible is really important. And one of the ways that I really was able to appreciate that was through listening to my patients' stories when I had more time as a med student. And of course, as a resident, that's going to be really challenging. I'm sure you can really feel that right now, because you're just about to wrap up your intern year. But it's just something that I think I was really able to appreciate when I was a student, and is something I want to hold on to as much as I can moving forward, even when I don't have the time, is at least recognize that every patient comes in with a story and how powerful that is and how that shapes how we approach the ways that we interact with the communities that we want to help. And I agree from like the medical education side of things, the few opportunities where I was able to engage in some type of like narratives in medicine workshop or, something that was like more rooted in storytelling was really, really impactful for me and helped me grow and shape my perspective and like how I wanted to approach medicine. And that includes Bundle of Hers. I feel like Bundle of Hers is like a place for us to tell our stories. Something that I've always really appreciated about this platform is that we don't come in as the experts. We come in as just people in medicine talking about our experiences, how they relate to our identities and things like that. And it's very much so rooted in that storytelling. And I feel like I at least hope that our listeners like can appreciate some of that too and kind of see like how impactful like storytelling really can be in that. But we talked about a lot of things. Wow. I'm like, did we cover it all? Did we like do this topic justice? But I think this has been a really awesome conversation. One thing I guess I kind of want to wrap up on is another thing that you alluded to, is connecting storytelling to activist work. I think when we think about activism and we think about doing social justice work, we typically think of like more traditional organizing or protesting, and all of those things are really important. But I also feel like creating spaces to preserve stories and like really develop community through a means of storytelling is a way to rethink activist work.
I feel like that is so true. And that's also, I feel like, why like some stories and narratives people try to erase, right? With like people in like positions of power. And it's because stories are a way of like being able to provide perspective and to like provide nuances and like different truths to a situation. And I think a lot of like what people try to do is to try to control the narrative, right? That's like a lot of like what people do is they try to control the narrative and they try to like give a certain narrative. But stories ultimately destroy those attempts, especially when they're coming from places that are often unheard and often like not given the space. And activism, I feel like, is like always about like elevating voices and like stories that are not heard of before or that just don't get the platform that they deserve to give.
Definitely agree. I was talking to one of my friends about this, and I think at times we all feel some level of inadequacy when we're pursuing activist work because it always feels like we're not doing enough. But sometimes when we come back to connecting to the things that we really believe in and preservation of cultures through storytelling and things like that, connecting to our identities and really celebrating the things that really make us who we are is a really, really important way to approach activist work that I think it often gets neglected in a lot of these spaces. And so I hope that for our listeners today, this inspired you to kind of think about the ways for you to explore creative outlets and reimagine what activism and resistance can look like, especially through storytelling. So yeah, thank you all for listening to our podcast. Sorry, guys, I don't know how to end this. Take it away.
Well, all to say is thank you, our dear listeners, to listening to it. I like to think something that I recently came up with is that we are all works in progress, including this episode is a work in progress too. But I hope that it really has helped you, like as Miriam said, start getting like your creative outlets rolling. And we want to thank you. Listen to us wherever you listen to podcasts, be it Spotify, be it Apple Podcasts, be it the Bundle of Hers website. You follow your heart there. And you can also follow us on Instagram at Bundle of Hers. And listen to us. We'll always have like episodes every other week. You can hear our controversial hot takes on things. You can maybe hear Miriam and I like loving each other because we're soulmates. Yeah, we are.
We're in love.
We love each other. Yeah.
Okay. Thank you, dear listeners. We love you guys too. Bye.
Bye.